All right. Well, hello and welcome to another edition of IPC's Vendor Advantage Network, our monthly spotlight series. If you're not already familiar, my name is Shannon Battle. I'm the Pharmacy Services Manager here at Independent Pharmacy Cooperative, and I work with all of the wonderful vendors like I have Nicolette here from Atrium 24. We bring these vendors to you to really contract and get the best programs, help your pharmacy grow, and just stay profitable overall. So, like I said, today I'm here with Nicolette Matthew from Atrium 24. Thank you so much for being here today, Nicolette.
Yeah, thanks, Shannon. Thanks for having me. I'm excited
Yeah,
to be here today, talk with you guys about pharmacy and all the opportunity that we have.
yeah, absolutely. We've been following your growth for, quite some time and love to see all of the new innovative things that you guys are doing, all of the industry data that you're getting and how you're really pivoting and getting that data out to the stores. So please give me a little bit of background on yourself. Tell us, all the meat and potatoes of HM24 and Dottie.
Yeah, absolutely. Thank you. So my name's Nicolette. I'm a pharmacist. And I essentially built the software platform that I'm going to show you out of necessity. I had my large pharmacy that I sold about 2 years ago. And I was just struggling with what's going on in my business. I had sales reps. What are they doing out in the fields? And then all the questions. So what should the message be? How do we better serve our patients? How do we, make sure that the pharmacy stays viable? And how do we grow the pharmacy? And so fast forward to now, we built a software tool, just like you said, that pulls in a ton of data points, and it's a true sales enablement platform for pharmacies. So I've probably seen you guys along the path, at all the different pharmacy trade shows. I've worked in this industry, in pharmacy for over 25 years. But specifically for independent pharmacies, I've been working here for about 15 years with pharmacies. And I'm just excited to show you the Dottie software, where we're connecting your dots between your sales and marketing initiatives. And we have our Atrium X conference that that IPC came to, our very first flagship year earlier this year. And we're having it again next year. So I'm excited to dive in and just show you all the solutions and how we're helping all different kinds of pharmacies dial in on their business and what's going on, and then what they can grow.
Perfect. Well, let's see this ecosystem. What do we have going on here?
All right. So as we all know, and we like to talk about what's positive, but just to level set, there's a challenge in independent pharmacy right now. So reimbursements are rough. There's a lot of commercial fills. If we just keep our head down and let whatever's going to walk through the door, it's most likely not going to be profitable or sustainable for the pharmacy, and that's the traditional model where we hang up our shingle and we provide great service. And then we have below water reimbursements. The foot traffic just doesn't cut it anymore. So where do we see growth happening? It's really fascinating. There's high margin compounds, there's 503B products, pet meds, cash pay options. And interestingly, with the online market, a lot of our pharmacies were already losing patients to online, telemedicine or online for their wellness or their peptides or something like that. So within our ecosystem, if our pharmacies, they utilize our software, you can keep those patients in-house because we help you with just all the different ways that you can compete with those online services that patients are going to, they're seeing commercials about, and we're able to keep those in your brick and mortar pharmacy, because otherwise these patients are experiencing polypharmacy. They're getting some meds over here, some meds over there, and they should be getting all their prescriptions at your pharmacy. You should be able to do so profitably.
Right.
So that's kind of what we're all trying to figure out. And with this ecosystem of bringing in not only your retail products, but what else are your patients taking? What else are they interested in? And being able to do all of that under your own roof. So we have a couple of, sorry, go ahead.
Well, I was just going to say, something I heard recently, and I've seen it repeated, is that, pharmacies are trying to be innovative, come up with new ideas, and all of these things that we think maybe we should get into aren't things that are new to the patients. They already expect these things. So we really have to catch up and do that.
Yeah, that's exactly right. Because now more than ever, patients are being marketed to. So there's a ton of direct to consumer marketing. And so you need to not only dial up, all of us need to dial up our direct to prescriber marketing, because those are your referral sources, and your direct to consumer marketing. So here's just some case studies on a few of our pharmacies that work with us and work with the Dottie system. And we teach pharmacies sales enablement, sales CRM, sales processes. And so it's a lot of that implementation, right? So how many of us, we go to a trade show or we hear about a really cool thing, and just like you said, we want to bring that into our pharmacy. We want to bring that to our patients. Well, there's a ton of challenges. Just a lot of pharmacy owners are overwhelmed. They're wearing a bunch of hats. They're dealing with staffing. They're dealing with audits. They're just very busy, pulled in a lot of directions. And so if you're able to utilize a platform like our Dottie software, now this is your enablement tool. This is your implementation piece. So you learn about the product. I'll show you through these next few slides how we actually train your team, get you the marketing resources, show you who the prescribers are, what the message is, what their data says. But these are just a couple examples of some pharmacies who have done just that and really dug in. And they've qualified from a level 1 sales organization to a level 4, for example, at Cypress. Or even our more sophisticated pharmacies, they might have a rep, but then there's always so much more that we can do to make our businesses more sophisticated. So we've seen a pharmacy, if you look at the one on the far left, they've grown tremendously. They were a pretty new pharmacy when they started with us. And they've grown a ton. The one in the middle, Flatirons, they're a great compounding and retail pharmacy. So they've increased their gross profit per month. They kept their prescription count about the same, but they've greatly increased their profitability by targeting those specific prescribers that were really moving the lever for their business. And then at Val Vista, they really focused on all different types of products. So they doubled their script count. Their margin grew tremendously. So all these pharmacies are having some tangible growths, and all their businesses look different, and all their product mixes look different. Because really, if you've seen one pharmacy, you've seen one pharmacy. Every market is so different. The payers are different, the prescribers, the patients. So when we're looking at those sales levels, pharmacies can definitely grow by growing their sales strategies. So like I said, most pharmacies rely on word of mouth or maybe a scattered outreach, like, oh, I'm going to go out and visit a few doctors before the holidays, or I'm going to go and then I don't know when I'm going to go back, or where the notes live from when we last went back, or we used to have a sales rep, we don't have them anymore. Where did all those notes go? But in today's market, especially with all the competition that we have facing us, we need to build repeatable, structured sales systems that will last and sustain, no matter if you have staff turnover, no matter, if you have the time or you don't have the time. So that way, the next kind of big opportunity that comes your way, you're ready just to execute on it. So,
Yeah.
Yep. So if we look at level 1, reactive, and our pharmacies are clinicians, they're patient care experts, they're not sales experts usually. So a lot of pharmacies live in level 1 and they're reactive. So they don't have a CRM, which is a customer relationship manager, which all big sales organizations have, but typically independent pharmacies don't have. And then, they don't have a sales rep. They don't have sales engagement with their prescribers. They rely on word of mouth. That level 1 used to be okay for independent pharmacies to operate, but now, with the reimbursement challenges and things, we have to think outside the box a little bit and actually leave our box and go talk to folks in our community. We help pharmacies scale all the way up to level 5 with our software.
Yeah, I love the just a small bit of added steps within each one of these levels, so stores can figure out what works for them, what's the next step, where they should start instead of trying to go all in.
Yeah. And it takes time. It absolutely takes time, and it takes, resources. So definitely just doing an honest evaluation of where you are. And that's exactly right. What small steps can you take? Quarter 4 is coming up, for example, or so I always like to think of things in quarters, because it takes time to implement these things with everything all of us have going on. So just seeing how can I get from a level 2 to a level 3 this quarter? Or how could I And like, what kind of pieces could we implement? What small changes could we make across our organization, across the entire pharmacy? And so we really focus on, when you talk about moving the needle and like what's going to make the biggest impact, we see that prescriber marketing makes the biggest impact. So direct to patient marketing, you don't have a lot of control over it, and there's a potential for low ROI. So, if you're just talking about general social media, about your pharmacy or about your services, you should absolutely do it, because these patients and these prescribers need to hear your name over and over again. You need to build that.
Yeah.
You need to build the brand, build your reputation, and the prescriber focused outreach. That's when you can start to get into that predictable profitability and that high ROI. So a lot of times in our software, we see that the customer is the physician that treats that patient, that writes that prescription, because as soon as they are comfortable with your pharmacy and your services and all that, then they're a true referral source for you.
Yeah.
So we've had our pharmacies target high margin products like the GLP-1s, pet meds, and even just growing script count with intention and strategy. So in our software, like I'll show you, you can see specific prescribers, specific trends. So you might have a doctor that sends you a ton of volume and a ton of business, which is great, but the profit might be very low. The gross margin might be very low. So if you look in the data set, what is this prescriber writing? Well, are they writing for other medications that are potentially profitable that maybe they're sending to another pharmacy out of state or something like that? That happens a lot. Or, where do we need to plug the holes in the boat so that we can serve that patient and that prescriber and keep that potential profitability in-house? And so where our software makes it scalable, we have a CRM to manage those prescriber relationships, and that's where you'll put all your notes. So a lot of times in our pharmacies, we might have Post-it notes everywhere, or you'll have like a Google sheet where you'll put some notes about prescribers of this. So our Dottie software, because that's just how it is in pharmacy. Paper everywhere. But in our Dottie software, it automates. It pulls in all the data from your pharmacy management system. It puts all the prescribers in there, and it gives you a place to put all those notes. We also have branded sell sheets. We have over 300 different marketing resources, which I'll show you some that when you download them, Dottie puts your logo and branding on them in real time. And we have all the data tracking from your PMS in your system to identify and optimize your top prescribers.
Perfect.
And so you mentioned the ecosystem, which I love. So I always say it's kind of like if you give a mouse a cookie, it's going to want some milk. So we first started with our CRM, and we were like, okay, we need a place where we can track our prescriber interactions, we can manage our outreach, organize our follow-ups, and we need it all to be as automated as possible. And so that's what we built. We built the CRM. Every day it updates with all your dispensing data from your pharmacy management system, automatically loads your prescribers. We built the first CRM specifically for pharmacies. So once we had that, we were like, wow, this is great. What can we do with the data to help pharmacies just understand, okay, what should I do next? So our pharmacies in Dottie have access to real world insights from over 200 pharmacies across the country. We're in 42 different states now and growing, to identify. Yeah, so it's been a journey, but it helps just to very quickly and easily identify high margin drugs, profitable prescribing trends. And what I like too is in our data share tool, where everything's completely de-identified and you're able just to kind of search the database and see what's going on. We don't make any switch recommendations, or we don't say, oh, this patient's on this med, switch them to, we don't do any of that. That should be left for the clinical judgment. And we give pharmacies an easy way to digest the data so that whatever question you're trying to answer, whatever you're trying to look at, you can just do so easily through our software. So I like that. The branded marketing is cool. I'll show you that. That's always a huge, I didn't want to go out and visit offices from my pharmacy, or my rep would get frustrated with me because they would go out maybe with an order form or maybe with like a patient education sheet, and the prescriber would want some changes in that, and they bring it back to me at the office, and I'd be like, oh man, I just don't have time to make all these marketing
to do all that. Yeah. Well, like you said, the stores, they're not salesmen, nor are they marketing, people. So it's great to have all this at their fingertips.
Yep. So we love that too. And that's probably the biggest used feature in Dottie, or one of them, is our marketing resources. And then we have a GPO. I say it with an asterisk because it's for very niche products. Mm-hmm. It's on the compounding side. So it's for the 503B. So if your state board allows your 503A pharmacy to purchase from a 503B, we just have kind of the highways built and the inroads. We have about a half a dozen different 503Bs in the network now and growing. But it just pretty much helps you to be able to offer your patients and your providers sterile compounded products without you building out an entire sterile lab, which is nice. So there's that too. And especially that just goes along to think about, you want to keep those patients in house. You don't want to lose them online, just online outfits. So, even when I had my big pharmacy, I would get patients coming in looking for sterile products all the time, and I'd have to just send them away, send them to another pharmacy. But this way you get to keep them in house, which is nice.
Yeah.
So this is just a little snapshot of the data share that I talked about. So it's real live data updated daily. You can search by a medication name. You can search by an NDC. You can validate the market claims. So you can even just see, what's happening, and you can drill down by your state. You can drill down by certain BIN PCN group numbers, see the primary and secondary payer info. You can see what's loaded in the de-identified: acquisition costs, copay, gross profit, and things like that. But we saw there's a lot of compound information in there too. So we saw like tirzepatide and glycine, which is very profitable. Now we know there's all kinds of stuff going on from the FDA and from the state boards, it's always changing. I actually just got back from Washington, D.C. last night because there was a compounding group that had a conference and a meeting, and it was a lot of legal panels and all this thing. So it's always changing. And we're always putting out webinars every 2 weeks, just about, hey, this is what's going on. This is what the FDA just published, or this is what this company's doing. So something to always stay on top of. So I always like to talk about it with a network. This is what's happening in our industry. This is what we're thinking. What are you guys experiencing? And then we have the data side in our software. So we say, well, what's the data showing? So I think it's always important to be cognizant of both. And these are just a little smattering of the marketing pieces. So this example is glutathione, it looks like. And so let's say you wanted to pull in glutathione from a 503B partner, or if you're going to sterile compound it yourself, you make that product. And then when we think about implementation and pull through, what do you do when you bring a product in, right? Well, we need to train our team on it, and we need to train our pharmacists. And so we have that in Dottie in our Learn menu. We have clinical training videos. All of our webinars live in there. And then we need our marketing resources. We need our sales collateral. So inside of Dottie, we have things like RX order forms, prescriber sell sheets, patient information sheets, retail pricing guides, patient bag stuffers. And when you download each of these, you'll see there's a Dottie logo on them. That's just a placeholder for the presentation. Your pharmacy logo actually gets loaded on each marketing piece in real time. So that's useful. And every time we roll out a new program, we're like, okay, well, we need the training videos, we need the marketing collateral, we need to build the data filters so pharmacies can see. So we have all these kind of programming for over 30 different specialties. We just launched a la carte marketing materials for our Dottie members. So if you want a specific flyer for your pharmacy or a specific brochure, you can order that as well.
Are any of the forms that you have, kind of like the ones you have pictured here, any of them customizable, or is it only to your logo and pharmacy information? Like the order forms I think you mentioned, or anything like that?
Yeah, so that's a good question. So in the basic, we have 3 different membership tiers. So we have basic, plus, and pro. In basic, you get some of the menus in Dottie and some of the marketing materials, about 100 of them. And then in plus, you get all 350 and the entire, all the data tools and everything that's in Dottie. And then in the pro, that's when you get fully customized marketing materials and one-on-one consultation with our clinical team, our sales team, our graphic designs team, whoever you want to talk with. And then just if you're in the plus or the basic memberships and you wanted to customize some of these, you can do so a la carte.
Okay, perfect.
Yeah. And I know the real world example, that's actually my pharmacy when we had, you know, I had sales reps and they were going out and we had the big compounding lists, which is wonderful, of all these different, hey doc, you know, it was a podiatry form. These are all the different compounds that we could make for you. And they were like, okay, great. Make, you know, I want all these things. And so then we had to purchase $30,000 in just all different chemicals and APIs.
Yeah.
So if you're going to go out and market certain things to prescribers, you want to make sure that you have the whole piece figured out. And just what are we marketing? What kind of overhead is that for our pharmacy? How are we actually going to pull it through? So
that's good information and insight to have for sure.
Yeah. Yeah. Cause I mean, it's a whole thing. And especially if, remember, incrementally, we're trying to grow our sales levels. So we're not trying to invest a ton of money in a complete overhaul of our business, because that's just not sustainable. We're just trying to make little tweaks based on your own data, like, hey, this is an opportunity, or hey, go talk to this prescriber because their profitability just dropped off, you know, 20%.
And it's easy to see a new idea or a new thing out and say, hey, we're going to jump in, we're going to go all in. And like you said, you know, you end up investing all this money for something that's not, you know, long-term sustainable. Or we know as quickly as things change, it could be over as quick as you get started. So for sure that those baby steps are important there.
Yeah, that's exactly right. Pharmacies have to, they have to just be careful with their resources, because, you know, we don't have a ton of them. So, so this is a snapshot of our CRM. So in the Dottie CRM, all your prescribers get loaded. And so, whereas if you would just get a CRM off the shelf, it's not customized for pharmacy. It's usually a lot more than we need, a lot more fields and a lot more customized options for all different industries, whether you're selling hats or pizzas or whatever it is. But this one in Dottie is 4 pharmacies, and it automatically loads with all your prescribers. And then it'll tier them, and it'll show you, these are your top prescribers based on prescription volume. These are your top prescribers based on profitability. And so if you're going to just start somewhere, like, well, you know, this month, go visit your 5 top profitable doctors, you know, or go visit and then put the note in the CRM. Mm-hmm. So, you know, we do connect to your dispensing data. It's updated daily, automatically. And it just helps you to know where to focus. And so that's been just really the biggest innovation.
Are there any limitations to which PMS systems you guys integrate with?
We integrate with most pharmacy management systems, so all the major players. There's been a lot of new ones popping up recently, and so we integrate with some of them. We have more in the pipeline, but definitely all the major players, all the pioneers and the RX30s, Computer RX, QS1, Best RX Prime, all the Liberty, DRX. There's a bunch.
Good. I love that. That's where most of our members are anyway.
Yeah. So and we always want to not overwhelm pharmacies either. You know, CRM is a new process for a lot of pharmacies. It's just not our traditional way of running our business. So we have in our Learn menu, we have a lot of different videos, and we have sales training courses. So we have our, it was a 6-week boot camp that we did. So if you are going to start using the software yourself as the owner, or as, you know, the technician who's going to like start working on leveling up your sales system, you would start with that boot camp process and just learn from a pharma rep perspective. How does a pharma rep go talk to prescribers, work in the field, use their data? And that's what we employ in Dottie. And even if you're going to hire a sales rep, that's the boot camp, sales and marketing 101 that you would have them watch. And then what's cool is all your data is already loaded, so they can start seeing real examples of, oh, well, this is what they mean. This is who I should go visit. And this is what message I should bring to them. So the CRM, we see pharmacies just with a lot of success with that. And this is just an example of scrolling through the software. Our tool is very sticky, meaning that our users typically log in every day And on the dashboard alone, and it's refreshed every day, they can see what's my profitability. I can drill down, like this is last 30 days. I can look at yesterday. I can look at last week. I can look at year to date, month to date, whatever you want to do. And I can see my top prescribers, my top drugs by gross profit, recent CRM activity, if I want to just know what my reps have been doing just at a glance. And on any of these fields too, you can click into that doctor and then you can see exactly week over week or month over month what you're dispensing for them and things like that.
That's great to track all the efforts that you've been making or that the teams are making.
Yep. Yeah. So that's very helpful too. And just to help you to know from the dashboard, where should I drill in? What's going on with my business? Oh, and then I jumped the gun on this. This is the sales marketing 101 course. So this is where we want everybody to start, because it talks about hiring, routing, which is like which prescribers should you go to in which order. And then we talk about tiering. So who are like my tier 1 prescribers, my tier 1, my tier 3? How do I move them between tiers? All these are like big pharma terms. But if you think about it, pharma spends a lot of money for boots on the ground sales reps. So it works. We just kind of analyze the process and then retrofit it for independent pharmacy. We're like, what pieces can we take from that model and, you know, make it work for our independent pharmacies? And so that's what we do in this training. And then we also we actually have one going on right now. We have our Dottie Day. So every other week, we have our clinical and our customer success and our marketing, just talk about what's new in Dottie. I mean, I know we just did another software push last night. What are the new resources? What are the new webinars? What are the new products? So we have our Dottie days every 2 weeks. So that's fun. And that way too, our members get to talk to each other and ask questions and just see what's going on.
And that's really what you guys are based around, having the members talk to each other and industry professionals just learn from each other. I think that's the easiest way to learn, honestly.
Yes, absolutely. And that really ties in with our Atrium X conference too, where it's completely peer-led. Everybody votes on what they want the breakout sessions to be about. We have professional facilitators who come in, but the pharmacy owners are there to, and the pharmacists and the technicians and the operators, they're there to talk to each other. You know, like, this is what I did. This is what went well. This is what failed. These are the companies I worked with. This is what I would do differently next time. So definitely the group think is valuable.
Yeah. All right.
Yeah. And then just exactly what we talked about, high margin product access. And then, so the growth tracks, I mentioned we have 3 membership tiers. We have basic, plus, and pro. When I started Atrium 24, actually just over 6 years ago now, we only had the pro membership. So it was very one-on-one, consultative, custom. But then just over a year ago, we launched the Dottie software. And that's when we did the plus and the basic membership. So plus is all of Dottie, all the tools, all the widgets, all the marketing materials, all the data. And basic is you get some just to get started and get some wins. And then what we see is when the pharmacies start to get their return on investment for that with one product or one, you know, programmer, then they can upgrade to plus and
Ready
that's how
to
they're
move along. Yeah.
sales system. So we have list pricing, but for IPC membership and in the IPC Vendor Advantage Network, we have discounted prices, which are listed here.
Perfect. So I see the 14-day free trial. What if a store signs up, you know, reaches out and wants to see what all it's about? What realistically are they looking at in the first 14 days? You know, what kind of conversations are they having or access, or what's going on in that first 2 weeks?
Yeah, so it's essentially a sandbox, which is just a software term where you can play around in the software completely. All your data gets loaded, so your CRM will be loaded. If you're in basic, you'll just be able to see your CRM. You can watch all the webinars and everything during the free trial. And that's basic. In plus, all the data dashboards will be unlocked. So you'll be able to see all the data in dashboard, all the data in my data. In both of them, you can see data share, which is like the group drill down. But you can see all the data and play around with everything. The only thing that you can't do during the free trial, you can't download any of the marketing resources.
Okay.
But we just wait until the pharmacy is a full-fledged member until that's unlocked, and then they could download all the marketing materials to their heart's content.
Yeah. Is there any contract with this, or is it month to month?
There is. So just like any software contract, it's an annual commitment. Now, what we do, though, we offer the free trial just so you can kind of see it and see how it'll work in your business, and that'll make sense. We do let you move around tiers during your contract. So if you started as a Plus member and then you wanted to downgrade to basic, or if you started at basic, you wanted to upgrade to Plus or whatever it is, we do let you move around tiers during that annual contract. If a pharmacy wanted to cancel before that year is up, they would just be responsible for 60% of the remainder of the contract.
Okay. Okay. Perfect. Well, this is great information. I know a lot of our stores are asking for the same things that you guys are providing, the same information, and it really is a good outlet for them. So I know there's probably a few of our stores that are going to want to have more in-depth conversations about their particular needs, what level may work for them and how to get signed up. So at the end of this webinar, there will be a slide up that'll have a QR code. It'll take you right to the Atrium 24 and Dottie page on our IPC website. You can also just navigate to our website and go under the Vendor Advantage Network, and Atrium and Dottie will be listed there as well. Once you log in, you'll be able to see all the videos that we have, the IPC pricing, and then just the sign up opportunity. It does say start your free trial, but you can absolutely use that contact form just to get more information, make sure that it's what you want to do, and they'll reach back out to you. So Nicolette, I do appreciate you again. What are the dates for your conference coming up?
Yeah, so the conference is March 5th through 7th in Orlando, Atrium X conference.
Perfect. Well, I hope to see some of our IPC members there. I think it'll be bigger and better than last year. So excited about that as well. And I do appreciate you coming here again today. And until next time, I hope everyone has a great week in pharmacy.
Thank you so much.
Thanks.